Hey everybody, Dr. Amy here with Fortress Physical Therapy. Today we're going to talk and demonstrate what SMT is, and it also stands for Spinal Manipulative Therapy. I have my patient here, Kelly, who's going to be an awesome demo today, and I'll kind of just talk to you about why and when I utilize spinal manipulative therapy within a treatment session. So first I'm going to demo some techniques on Kelly, specifically geared at the neck. It is a great service, a great tool that we utilize as physical therapists, especially to help treat headaches, help treat TMJ issues, and even overall stiffness into the neck, as well as just this overall good feeling sensation of the spine feels like it needs to move. So Kelly's here today, and I'm gonna demonstrate a upper cervical or an upper neck manipulation technique. So patient's just comfortable, nothing crazy. And then I'm going to demonstrate also another technique that is geared towards this. We're going to go face down on this one here, Kelly, towards her, what we call this upper cervical or thoracic region, which is a very strong region that tends to get a little bit of what I guess layman's term junked up, but an awesome region that we tend to target when someone has perhaps maybe some upper spine stiffness, as well as even some shoulder pain. So this will help get some good clearance into achieving better range of motion. There. And then also, go ahead and flip onto your back for me there, Kelly. Also, SMT, although it does stand for Spinal Manipulative Therapy, you can also utilize other techniques on the extremities, such as an elbow technique, which I'm going to demonstrate here on Kelly, even techniques into the wrist that can cause this audible sensation or adjustment. As well as even manipulation techniques into the ankle joint or even knee joints. But today I'm going to demonstrate a technique that is commonly used for some elbow tendonitis, which targets a specific bone or joint into the elbow, geared towards the radius bone, because that bone does the rotation into our forearm. And again, that's the joint that I want to target. All right, just relax there. And this is also great for some tendonitis as well. Sometimes you will get an audible pop, sometimes you won't. It just really depends. I'm going to try one more time. So those are just some techniques that we like to utilize within a therapy session. And usually if it's indicated and the patient doesn't display any red flags or perhaps yellow flags, meaning dizziness, blurred vision, difficulty swallowing, especially when we're applying manipulation techniques into the neck, then if they're cleared, oh yeah, I'm going to go and apply that technique if I feel that it's beneficial for the patient. But as far as SMT applications go, the patient will tell you when they feel like they have some stiffness, as well as whatever symptom they present with. Because research has shown that we can't just apply a manipulation or an adjustment to one specific joint. How do you know what joint you're going to hit? I know based on research and based on the techniques that if I'm going to try to target the mid-neck, I have to start above, because that manipulation technique, as you saw when I was demonstrating on Kelly when she was sitting up, that technique or that application of that thrust is going to occur from a top-down approach when I apply my technique above my target segment that I'm looking to target. And when Kelly was flipped over onto her stomach and I kind of came across that upper T-spine or thoracic area, that technique or that effect tends to trickle from the bottom up. So if my goal is to target the mid-neck, I'm going to come above as well as below because I know I'm going to get the most bang for my buck. And it's going to make the patient feel better. The tissue is good, the tissue sensitivity or the tissue stiffness is going to decrease, and she's going to feel better. And then as well as, we reassess the symptoms. Same thing goes for the elbow. We don't always have to achieve an audible pop, but as far as the technique can be very advantageous and very targeted to a specific joint, especially when you're applying these techniques into the arm, the ankle, the knee, and overall lower extremity or upper extremity.